Over 40% of American adults are obese, which contributes to a growing number of chronic diseases. Obesity is a significant public health issue, and we must take a multifaceted approach, including personal responsibility, societal changes, and policy interventions to combat it. I have struggled with obesity my entire life. Unfortunately, also with diet and exercise culture as well. Today I will discuss the causes of obesity, the impacts it has on individuals and society, and the solutions we must pursue to address the problem effectively. Causes of obesity can be a poor diet and unhealthy eating habits, increase in fast food consumption and sugary beverages, lack of access to nutritious, affordable food in some areas, which are food deserts. And an example of a food desert can be found in many urban and rural areas across the United States, such as certain neighborhoods in Detroit, Michigan, or Southwest Philadelphia, where access to fresh, healthy food is limited. In these areas, residents might have to travel long distances to find grocery stores with fresh produce, or they might rely on corner stores or fast food chains that predominantly offer unhealthy processed foods. How this affects obesity is that they have limited access to healthy food. So without nearby grocery stores or farmers markets, people are forced to purchase food from convenience stores or fast food restaurants, which often stock unhealthy, high-calorie, low-nutrient foods, and it makes it harder for people to make healthy choices. There are higher prices for healthy foods. Even if there are some fresh food options available, they may be priced higher due to the scarcity of supply, making them unaffordable for many residents, especially in low-income areas. Dietary imbalance is another factor. People living in food deserts may rely heavily on processed and packaged foods, which are highly unnutritious in sugar, sodium, and unhealthy fats. These foods contribute to weight gain and increase the risk of obesity. There's lack of education and support in many food deserts, so there also may be a lack of nutrition education or resources that teach people how to make healthier food choices. This can perpetuate unhealthy eating habits. Increased resilience on fast food. Fast food chains are often more prevalent in food deserts because they offer quick, low-cost options. These foods are often calorie dense and nutritionally poor, contributing to an increased risk of obesity when consumed frequently. In sum, the combination of limited access to healthy, affordable food and reliance on unhealthy alternatives and socioeconomic factors can create environments where obesity rates are higher. People in food deserts may struggle to maintain balanced diet, which leads to weight gain and other health complications over time. A sedentary lifestyle can also impact obesity. The role of technology and screen time leading to reduced physical activity, decrease in outdoor activities, especially among children. So there's a link between obesity and cardiovascular diseases, emphasizing the importance on weight management and heart health. Socioeconomic factors include low-income families having less access to healthy food and exercise opportunities, as we spoke about, stress and mental health leading to overeating or poor food choices. Genetic and environmental factors are influence of genetic on metabolism and body type. Environmental factors like advertising and availability of unhealthy foods. So the impact of obesity would be health impacts, increased risk of chronic diseases, heart diseases, diabetes, stroke, etc., shortened life expectancy, and reduced quality of life. Economic costs include rising healthcare costs associated with treating obesity-related conditions, lost productivity due to illnesses and disability. Psychological and social impacts include stigma and discrimination faced by obese individuals, impact on mental health, including depression and anxiety. There's also a strain on the healthcare system, the growth and burden on public health resources and infrastructure. And there's a need for more medical professionals and facilities to handle obesity-related conditions. So personal responsibility and awareness would be educating individuals about healthy eating, portion control, and exercise, promoting a healthier lifestyle choice through community programs and social media. The government and policy interventions could be implementing taxes on sugary drinks and junk food to discourage unhealthy eating, or creating regulations on food labeling and marketing, especially for children. Changes in the food industry could be encouraging food companies to offer healthier, lower calorie alternatives. Also lower cost alternatives as well for food deserts. Community and environmental changes improving access to parks, recreation centers, and safe places for physical activity, or developing urban plan strategies to support walking and cycling. Healthcare system support could be integrating obesity prevention and treatment into healthcare practices, expanding insurance coverage for obesity treatments, including counseling and bariatric surgery. Another counter argument would be obesity is primarily an individual choice and a personal responsibility that is the key factor. While personal responsibility plays a role, external factors such as food deserts, marketing practices, and socioeconomic conditions make it harder for individuals to make healthy choices. Government interventions and regulations infringe on personal freedoms. Government action is necessary to protect public health and reduce the economic burden of obesity-related diseases, similar to measures taken to reduce smoking cigarette rates. So obesity is a complex issue that requires action from individual society and policymakers. We've discussed the causes of obesity, the wide-reaching impacts, and the solutions that can help with growing problem. So it's time to take responsibility and work together to create a healthier future, whether to make personal lifestyle changes, advocating for policy reforms, or supporting community health initiatives. We all have a role to play in combating obesity. Imagine a world where the next generation is healthier, happier, and free from the burdens of obesity. It all starts with each one of us making a change today.